Hi, my name's Suki and this is my vlog. I'm going to try and do one of these a week if I can, but obviously that's not going to be possible all the time. But stay tuned for regular updates, and any questions or comments, just put them in the comment section at the bottom of each of the videos. Back in the 90s, I remember when everybody was on ICQ and AIM, there was an abbreviation that everybody used that went by ASL, which, for those of you who are younger than me, stands for age, sex, location. So I'm 32, I am a transgender female, and I live in Glasgow. So why am I doing this vlog? Well, there are two main reasons. The first one is purely egocentrical. It's a way of me documenting my emotions, my feelings, and basically day-to-day life as I go through my journey. And the second reason is far more altruistic. If this can be a useful resource for anybody who was feeling as bad as I was at one point in my life, or just to give people direction or whatever, then I'll consider this a job well done. Okay, so let me tell you a bit about myself. I guess I'll start with work. I am a clinical fellow in oral and maxillofacial surgery, working in the NHS in Glasgow. I've recently been off work for quite some time, a couple of months in fact, and I'm on a phased return going back to work, and my first day back was yesterday. And it was actually quite lovely being back at work. Everybody was so warm, so welcoming, and indeed it's the first time I'm at work since coming out, so yeah, it was really nice seeing everybody's smiles, people giving me hugs that I wasn't expecting, and really quite overwhelming. For those of you who don't know, oral and maxillofacial surgery is a specialty we have here in England and the EU, where you need to be qualified in medicine and dentistry, so that's where I am now. I'm waiting to start my registrar training, which would be the equivalent of your residency for those of you in the States. And yeah, I'm just doing this post at the moment to try and build up some experience before getting a proper training job. So that's where I am with work. With regards to where I am in my transition, I am on the waiting list for treatment under the NHS, and here in Scotland the waiting lists are about 12 months long before you get your first assessment. So I've been on that waiting list a couple of months, and obviously I don't have an appointment through for that yet, but obviously I'm hoping to get seen as soon as possible. So I have been exploring private options, and the one that I'm going down, it's VSfolk, Gender GP. Now, some of you will be aware that there was some bad publicity recently. Take this BBC article for instance. Now, there are currently GMC conditions in place against Dr. Webberley, and Mike Webberley is taking care of her patients at the moment, and I'd like to say personally I've had no issues whatsoever. I am not taking any treatment from them at the moment. All I'm on at the moment is finasteride, which for those of you who don't know is testosterone blocker. It blocks the conversion of testosterone into dihydrotestosterone, and that's all I'm on hormone-wise at the moment. I think with regards to my state of mind and my mental health, I'm in a much better place than I was a while ago. Prior to coming out, I had been taking hormones that I purchased off the internet, which I would strongly advocate that nobody does. You don't know what you're buying, you've got no means of recompense if something goes wrong, and there's no way of you being monitored if you have any side effects. So I would strongly advise you to see your GP, tell your GP about it. Some GPs will be great and give you a bridging prescription until you can get seen on the NHS, and some will say, actually, I'm not comfortable with this. It just depends, but definitely don't buy anything off the internet. So yeah, before coming out I was quite depressed, probably say for about 18 months or so, and it was actually a very difficult time for me. So I put off seeing my GP as long as I could, but eventually it got to the point where I was kind of forced into going, and I went and saw her, and she was nice about things. I didn't come out to my GP at this time, I just told her that I was feeling depressed and everything, and I was put on citalopram at that point in time, and not too long after that I attempted suicide for the first time, and this was by taking an overdose of tramadol. And thinking back to how I was feeling there, I was just feeling so hopeless. There was an obvious precipitant to this incident, but I had initially tried to use a kitchen knife to cut my wrist, but it turns out kitchen knives are quite blunt. So I'd taken the overdose, and my wife, who I was with at the time, had called an ambulance for me, and on the way to hospital I had a seizure, and I stayed in high dependency for a couple of days. Whilst I was in hospital, I was seen by psychiatry, who made arrangements to see me as an outpatient, and then I was sent home. This happened whilst I was on annual leave from work, and then I took another couple of weeks after that of sick leave, and yeah, went back to work, and things were okay at work. There were lots of stresses coming from work at this point as well. It wasn't just the fact that I was trying to conceal who I was that was getting me down. I think it was a combination of lots of things to do with not being in a training job and just general day-to-day pressures of work as well. But yeah, I went back to work and things were no better than before, really. And second time I self-harmed was a little bit after this, and I cut myself. I cut a vein that time. It was very impulsive, and I can't remember what my intention was at the time, whether it was just to hurt myself, whether to get some attention, or whether there was any suicidal intent. I'm not entirely sure right now, thinking back, but was taken to A&E again, where I was stitched up. I didn't even speak psychiatry this time. The lovely A&E doctors spoke psychiatry for me and sent me on my way home, and I was actually back at work the following day, which, thinking back, probably wasn't terribly sensible. So after this second attempt, I saw my psychiatry consultant for the first time as an outpatient, and told him everything apart from the fact that I had been taking hormones which I'd purchased off the internet. I did tell him that I was transgender, and he was supportive and he was lovely, and he suggested switching me from the citalopram to venlafaxine, which is a stronger antidepressant, which is quite good if you have any anxiety type symptoms as well, so he said. and he made arrangements for me to be seen by clinical psychology, but apparently in Scotland the waiting list for clinical psychology is another 5 months. So I still, again, haven't heard through from them yet. Now, not long after this, things became a lot worse at home between my wife and myself, and she left and moved out, which obviously left me devastated, although with hindsight I can't say that I didn't see it coming. Now that was on a Friday. I was back in at work on the Monday, and obviously not eating terribly much at this point. On the Tuesday in clinic I collapsed because my blood sugar was low, I was a little bit anemic, and my blood pressure was a bit low, a combination of things, and I got signed off work for the rest of that week. And being at home by yourself, alone with your thoughts, yes, you've got lots of friends, but when you're in that position you just feel so isolated. You don't think you can talk to anybody, you think nobody cares, and you're in a horrible place. So on the Thursday night I planned to kill myself, which I very nearly did. I don't know what kind of frame of mind I was in, but I did the washing, I hoovered the flat, and I wrote some notes, and got into the bath and cut one of my arteries with a cutthroat razor blade. And the last thing I can remember was not wanting to die by myself. It wasn't that I didn't want to die. And I think I called the ambulance services, but I can't remember saying anything to them. And then the next thing I remember, the next thing I remember was waking up in A&E with one of the A&E consultants who I know quite well. She was one of my tutors when I was a junior doctor. Stood over me, and then she gave me a massive hug, and yeah, I remember feeling quite blunted at that point in time, you know, just like, oh, okay, I'm still here, but neither up nor down, just like nothing was really getting through to me. But it turns out that I needed essentially my whole blood volume transfused. So again, I spent a couple of days in high dependency, had my artery repaired, but this time I was transferred to the care of psychiatry, who are absolutely lovely. I've got nothing but praise for the psychiatric services, and I think it's a very difficult place that they're in, with the increase in demand for psychiatric services and not enough staff at all, either nursing staff, psychology staff, or medical staff, and I think it's just terrible how under-resourced they are. So I was initially in under them voluntarily, but subsequently became a little paranoid and got sectioned. But the section got lifted subsequently. I was allowed out on pass and eventually discharged, having been in hospital for about 4 weeks. Since being discharged, I've been advised by the psychiatric services and the crisis team, who were initially coming and seeing me on home visits, to keep myself busy, which I've been trying to do. But it's difficult when you're a doctor, most of your friends are doctors, and they're all working doctor hours. So it is difficult. You find yourself by yourself a lot, alone with your thoughts, which again isn't good, because you can sometimes go back to those dark places. But I can honestly say I've not had any thoughts of self-harm since since my section was lifted. And coming out, I've been in a much better place in my mind as well. My mood's been great. I've been laughing and joking a lot more with my friends, and I'm sure they'd all tell you that I'm certainly looking a lot better. I've been putting weight back on. I was quite underweight when I was in hospital. I'm borderline underweight now, but I'm moving in the right direction. So making steady progress as far as that's concerned. But yeah, occupying myself during my time off, it seems rather superfluous and frivolous, but I spent a lot of my time shopping, browsing, internet shopping, eBaying, selling old clothes, buying new clothes, going out for coffees with friends, going out for drinks, cocktails. These are all things I like. So that's what I was doing. And then finally got my appointment with occupational health. Was it last week? I think it was last week, last Wednesday, and it was one of the occupational health doctors, who are a very, very rare breed, almost as rare as a Scottish national animal, which is the unicorn. So I saw the occupational health doctor, who was lovely, and actually seemed to be asking me more questions about trans issues than I was asking him about returning to work issues. But that aside, he cleared me to go back to work on the proviso that I don't do any on-calls for the first month when I'm back at work, which I'm not going to complain about. And I had my return to work meeting with the departmental lead on Tuesday of this week, which was lovely. And finally went back to work yesterday, as I've said. And I am so relieved now. You wouldn't believe it. So that's where I am with regards to my mental health right now. The only other thing I would add there is, if you do know anybody who might be struggling with their mental health for whatever reason, I would advise you not to let them suffer in silence. Talk to them, listen to them if they want to speak, give them a hug, anything to let them know that they're not alone in this. Now, I guess I'm going to get a bit factual for this next bit. The way I see things, and I'd like to state that unless otherwise specified, all of this is my personal opinion, anecdotal, very little evidence base. But I think that transgender is an umbrella term which is broad and encompasses a wide variety of people, some of whom, you may or may not think that they're transgender, including non-binary people, possibly including genderqueer people, intersex people, agender people, whatever. If somebody identifies with a particular label, that's fine. There's been a large proliferation of labels in the last 10 years or so. Some of it's useful, some of it's not. But I do think that we should try and respect somebody's right to autonomy, and if they wish to have a certain label, then I think we should use it. If you have any friends, colleagues, relatives, whatever, who may be non-cisgender, then just be sensitive, don't be a dick. Use what name they wish to be known as, use appropriate pronouns and use appropriate titles. It's not difficult, and it's not infringing on anybody's rights. Just be kind, and there's not really much more to it than that. Issues of privilege. Recognize that everybody has certain degrees of privilege for certain reasons, depending on which society they live in. I myself have had a lot of privilege through my life. For the first 31 years of my life, I benefited from male privilege, although I certainly did not benefit from white privilege, and now I'm not going to be benefiting from cisgender privilege and certainly not benefiting from heteronormative privilege. However, I would say that I've come from a reasonably well-off middle-class background, having gone to private school, and the fact that I'm an atheist living in the UK doesn't mean I'm going to be persecuted for my beliefs, as it would in certain other countries. So I'd certainly say that I'm very privileged compared to others. But yeah, while I'm talking about privilege, also issues of intersectionality. You know, don't be insensitive to issues of intersectionality. Just because somebody is disabled doesn't mean they can't be transgender. You know, people can be any number of minorities and have issues because of one or all of them. People can be discriminated for a variety of reasons. So I'm not going to go into basics of intersectionality or feminism just now, and I know some people get uncomfortable about transgender people talking about feminism, so I'm going to maybe save that for another vlog. I think I'm about done for today actually. I don't think there's anything else I want to chat about, but like I say, any questions, comments, anything you'd like to see in future, just stick them in the comment section and I'll try and answer them and address them as and when I can. So that's me, over and out.